Good evening and thanks for joining us. We want to start with some promising news tonight. The federal government says it has made lots of progress on getting much needed personal protection equipment for frontline workers. And the strategy is very much made in Canada. Nearly 5,000 companies, we're told, across the country have offered to retool to make medical supplies. An auto parts company, for example, is using airbag material to make hospital gowns. Other companies have struck a deal to make up to 30,000 ventilators. It's all part of Ottawa's plan to buy, and build until the medical system has what it needs.
We have told these companies across the country who've put up their hands to go ahead and get building ventilators as quickly as possible and as many as possible in case we need them in Canada. We certainly hope that we won't be needing all those ventilators.
The government is buying supplies from overseas too. Gloves, gowns and masks in a market that's described as like the Wild West. Countries are all competing for the same dwindling pool of products. So far, the federal government says it's sourced more than 230 million surgical masks. Over 16 million, it says, have already been delivered. In our top story tonight, Mike LeCouture looks at the Canadian companies that have taken up the call to help.
It was a lifesaver in the 2003 SARS outbreak, and an updated version of the Winnipeg ventilator could help thousands of Canadians survive COVID-19. The Canadian-made ventilator is being retooled by a cluster of companies, including Starfish Medical, that hope to accomplish the Herculean effort of making thousands of these in a short time frame.
Normally something like this would take 2 or 3 years, and we're compressing it into weeks to months. We were hoping that we'll get through all of our clinical testing that we need to do and regulatory during May, and then we'll be manufacturing as soon as we can.
At the same time, the Prime Minister has tapped Nobel Prize winner Dr. Art McDonald to fast-track his easy-to-make ventilator, which will be tested in Italy.
We hope to get full medical certification there. We've been working closely with the FDA in the U.S. and Health Canada. We expect to be able to produce these objects starting in a few weeks' time.
The federal government has ordered 30,000 ventilators, even though Canada may not need that many. But if we don't, Prime Minister Justin Trudeau says they won't go to waste.
We will have ventilators to share with other countries that are facing more difficult circumstances. For us, doing more right now, doing quicker right now, is really the only option.
Manufacturers like Canada Goose and Stanfield's are now retooling their operations to make medical gowns for frontline healthcare workers. The government is also in talks with nearly 5,000 Canadian companies to make personal protective equipment, so we don't have to rely on buying it from other countries because supplies are so scarce.
Ordering, of course, does not guarantee a delivery.
The lack of PPEs has frontline workers worried will run out, and the nurses' union is appealing to citizens who are now wearing masks.
You see somebody from the public wearing a surgical or an N95. They don't belong on the street, they belong in our healthcare system.
Now, there's a huge rush to get all of this equipment, but faster isn't always better. The City of Toronto had to recall about $200,000 worth of surgical masks, citing poor quality. And those masks were sent to long-term care homes where the need is even more acute. Donna?
All right, Mike LeCouture in Ottawa, thanks. The Premier of Alberta says his province is facing a triple threat: COVID-19 and the collapse of the economy and of energy prices. Jason Kenney released 2 disease models tonight. He said the probable scenario is that infections will peak in mid-May and that there would be between 400 and 3,100 deaths in Alberta. And this, he says, is the elevated scenario.
Under the most serious but less likely elevated scenario, we would see infections peak at the beginning of May with as many as 1 million infections and between 500 and 6,600 deaths. But these models are not a done deal. I want Albertans instead to see them as a challenge, perhaps the greatest challenge of our generation.
Premier Kenney says restrictions like physical distancing will not be relaxed until the end of May, and he plans to ramp up an aggressive system of mass testing and do as many as 20,000 tests a day. Here are the number of cases in Canada right now. More than 17,000 people have tested positive for COVID-19. More than 1,200 new cases were reported today. Ontario and Quebec had the biggest daily increase in new cases. Ontario confirmed 379 more cases. Quebec reported 760 more people tested positive. But in BC, there were only 25 new lab-confirmed cases. That's the lowest daily increase that province has reported in weeks. And some breaking news from Ottawa tonight. The Deputy Minister of Global Affairs, Marta Morgan, has tested positive for COVID-19. The government says her symptoms are mild, and she is now self-isolating. The numbers across Canada don't affect the whole story, of course, because testing is still limited in Canada. And it's still too early to be certain of anything. But there are signs the overall curve in Canada is showing signs of flattening, especially in BC. One of the biggest concerns everywhere are outbreaks in long-term care facilities. There are at least 51 outbreaks in homes in Ontario alone. Eric Sorensen is analyzing the data again for us tonight.
Unquestionably, Quebec has been the hardest hit province. Now, a long-term care facility in Laval may have one of the worst COVID-19 outbreaks in the country. 105 residents have tested positive. 8 have died. As of today, in Quebec, 150 have died from the coronavirus. The province is projecting the number could be over 1,200 by the end of April. In a worst-case scenario, more than 8,800. But officials do say Quebec is on course to handle the outbreak so far. The Premier says this is a critical week to contain the spread.
There must be no gatherings, including for religious celebrations such as Easter.
Sound advice for the nation. As hard-hit as Quebec is, the Premier says the province is heading in the right direction.
We're making progress in our battle against the virus.
And so is the country making progress.
The number of COVID-19 cases in Canada continues to rise, but there has been an improvement in the daily numbers. After a sharp rise to over 1,200 cases on one day last week, the numbers began to flatten out a little bit. In fact, there were fewer than 1,200 yesterday. British Columbia stands out, no longer a sharp rise in the total numbers, and look at the daily cases. For 1 week last week, BC had an average of 71 new cases per day. But this past week, just 42 new cases per day, a distinct downward trend.
All of Canada is ahead of early infection forecasts.
Typically, this virus is doubling every few days, and we've definitely seen a slowdown in that. We're still seeing increases in cases, but they're not increasing nearly as fast.
What happened? A dramatic change in behavior everywhere. Google geolocated the movement of Canadians last month. Public transit hubs, usage down 2/3. A plunge in retail, shopping, restaurants, movies, many just closed up. A big drop in going to our usual workplaces, instead working from home. Even grocery and pharmacy, Canadians are going, but less often. A steady falling off in visiting parks as we keep our distance. And the one upturn, of course, residential, as we spend more time at home.
Because we saw people come together March 31st and stay at home, we should start to see the effects of that now in the second half of April.
Grim mortality numbers still lie ahead for this country, but by all indications, the main approach, staying away from other people, appears to have been the right strategy, if we can keep it up. Eric Sorensen, Global News, Toronto.
We will continue to consult with experts and try to answer your questions. You can send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.